Caroline, one of the things that we've been chatting a lot in Benefits Alliance over the years is about modernizing benefit plans. And we've been critical sometimes of our industry that hasn't been progressive enough. And we've led the charge in so many areas for our clients coast to coast around looking at some unique solutions. And today, we're going to have a unique company on today that talks about prescribed medicine. And most people aren't even familiar with the topic of prescribed medicine. What is it? It sounds expensive. It's really not. And then when we start hearing some stats about the number of people that were on the wrong medication, by just doing this test, that's been life-changing for individuals, it's going to be amazing.
Yeah, definitely. And I learned through some pre-research that there's a word we're going to learn about that came about from a Canadian. So it's a very Canadian episode.
Nice. Yay, Canada.
So listeners, watch out. We're gonna hear some words that were developed in Canada. But in all seriousness, you're right, Rob. We looked for ways to modernize a benefits plan, and very rarely is that control in the hands of the advisor and working with the plan sponsors. So group benefits expert advisors like yourselves and those at Benefits Alliance, this is next level. So we're going to bring in some scientists, some pharmacists, and we're going to talk turkey when it comes to finding an effective way to save money, help people faster, and do one thing one time that's good for your whole life. So if that's not enough to intrigue people, let's bring them.
I love it. Here we go.
Welcome to the Benefits Alliance Voice. Let's start off and introduce our guests today, Rob. So Veronika Litinski, tell us about your background and who you're with.
Yes, thank you for having us. I'm with a company called Pillcheck, and we deliver DNA-guided prescribing services. The service is called Pillcheck, and we work quite a bit with workplace benefits. And really, our goal is to make sure that when people need prescriptions, that the prescriptions actually match their unique genetic profile. Because we know from science that when there is a mismatch, all kinds of cascades of bad events can happen, from adverse events to medicine being ineffective. So I work with a team of very technical people who are super passionate about bringing the evidence-based insights to everyday use and make it accessible and affordable to everyone.
Wonderful. Thank you. Let's meet Dora Chan. Over to you. Tell us about yourself.
Hi. Thanks also for inviting me here. So I am a pharmacist consultant for Pillcheck and also a licensed holistic nutritionist. So I kind of work in the background and I review some of the reports, and I review for drug interactions, how the genetics can inform drug choice, and then sometimes I put in my nutritionist eye and put in non-drug related recommendations as well. So I'm very happy to be here with you guys.
That's great. And we're happy you're here as well. And last but not least, we have a fellow Benefits Alliance member, Gavin Mosley. So Gavin, why don't you tell the audience a little bit about your background and involvement in this space? And we're excited to hear your input today.
Thanks for having me. Yes, my name is Gavin Mosley. I run Mosley Group Benefits, and we've been working with Pillcheck and these more advanced testing diagnostic tools for many, many years now, and have fallen in love with them. We've seen direct impact with clients, and we really feel like diagnostics like this are the future of pharmaceuticals. And I kind of picture a Canada and a benefit system where these are just part of it. These are included. Our benefit plans aren't going to cover a lot of high-priced drugs without one of these. So that's really where I see the world going. And why would we work in a system where there's trial and error and throwing darts at a dartboard when we don't have to? So no, I'm very happy to be part of this conversation. Thank you for having me today.
Oh yeah, and there's a lot of good comments and thoughts from there, Gavin, that we appreciate that we're going to dive deeper into. But as advisors, we know on average that drugs represent about 70% of all healthcare claims in a benefit program. Drug costs are never going down. They seem to be always going up in cost on an annual basis. And with the rise of a lot of new specialty drugs that have come to market, which are life-changing for some individuals, that, sometimes companies are looking around going, okay, what are some ideas? And this is things that we talk about as an organization around modernizing benefits and modernized approach. So maybe to kick it off for the audience, the tens of thousands of people that are listening today, Veronika, maybe tell them a little bit about what is personalized medicine, how long has it been around, and why maybe decision makers that are listening today should be paying attention.
Yeah, great question. So personalized medicine is just like it sounds. It's personalizing the choice of treatment, whether it's drug, dosage, or intervention, to the individual. And kind of like the food, like shoes analogy. When pharmaceuticals are manufactured, the assumption is that everybody is average. Sort of like if we made shoes pretty much the same for everybody, that would be awkward. So with the personalized medicine, it's tools to adjust therapy to the unique profile of the individual. And the concept of pharmacogenetics, actually the term came out of Canada. There was a researcher in School of Pharmacy in Toronto who observed that people react in different ways to anesthesia. So he started to investigate it, and the term pharmacogenetics was born. It combines the science of pharmacology and genetics. And since then, I'm talking like 50s, 60s, many more pharmaceuticals became available, and also our understanding how to analyze genome and what does it all mean increased substantially. So we're living now, I would say, in the golden age of technology when these two distinct disciplines can be utilized on a routine basis. And when I first encountered that idea of pharmacogenetics, I thought, wow, this is science fiction. But then when I look deeper into the evidence published, and I got really motivated with my partners who are all super geeky, techie guys, to build something that's powerful but can be used by anyone. Because one of the challenges, I think, in our complex life is there's just too much information. So it's very difficult, even if you're a great physician and want to prescribe the best possible medicine for every patient, just to keep up with everything is so hard. And so with automation, we solve the problem of making sure that when I'm going to the doctor and the doctor needs to make a choice between 50 or 36 different prescriptions that could treat my condition, that this choice is safest and most effective for me.
That's great. That's great. And first, you're talking to people that geek out in benefits, so we're going to have a good chat right now. And then, this probably from your side, Dora, is just to follow up with Veronika's thoughts there around traditionally, like, GPs, because they have to know so much in so many different areas, that if it's typically, it's always been believed that if it's blood pressure, it's this pill. If it's cholesterol, someone's got high cholesterol, doctor's going to prescribe, he or she's going to prescribe this pill. And this is kind of where the pharmacist would kick in. So how have you found something like pharmacogenetics be kind of unique and a game changer from your side as well?
So I would say the majority of physicians aren't knowledgeable in pharmacogenetics. So one is a game changer because it's personalized. So we can kind of pick which medications would work the best and be most beneficial for a patient. But just on the side of pharmacogenetics for a pharmacy or a pharmacist who, like I'm specially trained for pharmacogenetics, I can take that extra step to help our family doctors and physicians and specialists. So they might get a report and it's just like gobbledygook, right? Just a whole bunch of letters and numbers. They don't really know what to do with that data until they provide it to a pharmacist who can then interpret it and then tell them, okay, this drug you might want to adjust, or this drug you might want to remove. We might want to switch this one and help with tapering, like all those little tiny details that maybe the physician doesn't have time to deal with, or they don't actually have the knowledge to. So it's a game changer for sure.
I have a very practical, basic question. And this one, I think I'll get maybe Gavin to walk us through this, because I actually have ordered my Pillcheck test, but because there was a postal strike, so I didn't do it yet because I didn't know if it would expire or what was going on. But what is the test? Like, what does that look like? What is the experience? How do you do the test?
It comes in the mail in a package, and you'll do a cheek swab and you'll mail it back in. So it's not overly intrusive. It's not You don't have to go to a clinic and draw blood like some other DNA tests out there. So it's anybody can do it. But what I like about the Pillcheck is that it's usable by people. You don't have to be an expert to understand it very quickly. Like, to break it down, it's got a red light, yellow light, green light style of experience to it. It's got all of your different conditions. So it talks about pain medications, talks about cancer, cardiovascular medications, all these different categories. And then it simply shows in the red light, yellow light, green light report of what drugs can be safely or not safely used for each of these indications. So even me as a non-clinician, it didn't take me long to understand what this is and how I'd use it very quickly. And let me tell you, once you see yours, you want everybody in your family to have one. You want everyone around you to have one of these. I think about, my kids getting hurt. And, I want to make sure I'd have one of those before they're prescribed something. And so it is a very interesting experience to go through. And even, one thing is if you're on the medication, it has a very direct impact, but I think more about all the things that I'm not taking right now, and I see that our clients are taking, there's a kind of a line I use. I'll say, well, if I'm in a car accident and I wake up in a hospital, I can tell the doctors not to prescribe me these pain meds. And I've had a lot of clients through disability, I go through surgery, and I've talked to one recently who had a hip replacement. And I said, oh, how's your hip? He said, oh my gosh, my hip's fine, but the adverse reaction I had from these nuclear strength pain meds were worse than the surgery. I was sick for days, and they had to keep cycling me through different ones because what was just, it was unbearable. And so, you get these stories working in this industry, whether you like it or not. And I'd say more so on the mental health side of things. So I'm very lucky. I show my report kind of all the time. I find these days, at least once a week, to clients and partners, and I'm pretty lucky. So on the mental health side of things, most of the drugs are in the green. But I have seen other reports where they're really spread out. And I think about all of our clients who, we're sitting there like the Grim Reaper every year at renewal, saying costs are going up and your disability claims are high because of mental health. And that's a huge part of our job these days. And I think all the time about, gosh, I wonder if all of these people, if they would have had a pharmacogenetic test, could they have got better help sooner? Could we have avoided a disability? So for someone working in the benefits industry, I have a very kind of layered approach to how I think about these reports. But even just the experience of it, it's not overly complicated. That's one of the reasons I really like this one.
Let's hone in on something specific. So what I'm gathering, so you do your cheek swab, you mail it in, you get a report, and then that comes, through, it's a specific report for yourself. I love that, red light, green light, yellow red light analogy. And you would review that with your doctor. It's a roadmap that tells you what's good for you, what's bad for you, what's going to work well for you for medications, whether you're on them today or in the future. It's good for your lifetime. But let's narrow in on a specific condition, something that impacts so many Canadians and people worldwide. Today, let's use one health example and let's go deep. Let's talk about ADHD. So I think I'll pass off and maybe ask Dora to comment on what you see in some of the prescribing methods, what typically happens today for a patient that's newly diagnosed with ADHD. That does not have a pharmacogenetics test in hand. What happens there? And then we can do a side by side.
Okay. So I guess, are we talking about pediatric or adult? I guess it doesn't really matter. So I would say if we were to go with a child being diagnosed with ADHD, so parents bring the child in, they see the doctor, they might talk about some lifestyle changes, they might talk about some dietary changes, and then they say, okay, we've tried everything, let's try medications. So typically, I would say the most commonly used medications are stimulant type medications, so amphetamines, that type of thing. And then they would just maybe pick one, sends the child home with the prescription, they try it, might not work, may work, might have side effects. So some of the more common side effects with these type of medications is poor sleep, can affect their sleep, it can affect their appetite, which then affects their dietary intake, nutrition intake, their growth, all sorts of things. So depending on how they respond, they might then switch to another type of medication, spend a few weeks on that, see how they do. If they don't like that one, they have side effects, and they switch to another one, and so on and so on and so on, until finally they find something that might work. And even if it does work, it might not work all the way. So there's so many nuances, and everyone's really different. So if they did have the pharmacogenetic testing, that would help us hone in on maybe a smaller handful of medications. What would we start first? So the pharmacogenetics would tell us how well that child might metabolize that medication. So are they metabolizing it too quickly so it doesn't work as well? Or are they metabolizing it too slowly so then it works better, but then they have a higher risk of side effects? Or is it metabolized normally, or what we would say normal, so that would be the best chance of working well and not having too many side effects? Then that would really help us to narrow down which medications to start with. And hopefully that's the one. And even if we do have to move on to another one, it's less trial and error. So it's much more personalized.
Are you able to speak to some of the results that you've seen since you've been working with Pillcheck, either Veronika or Dora? Maybe a question I'll just throw it out there for both of you.
Personally, I've made recommendations, but I don't always hear what happens afterwards. So I don't know if Veronika might have some ideas. Once in a while, I'll get doctors call just to ask me more clarification questions, but I don't actually get the intel on what happens after. So I don't know if Veronika has that data, or even Gavin.
Yeah, I am happy to share a little bit of, few examples. So one, we actually did a study a few years ago, not specific to ADHD, but to all medications included in Pillcheck. And it's published in a peer-reviewed journal, so no mystery there. 78% of prescriptions had to be adjusted, whether it was a drug or dose.
4 out of 5.
Exactly. Yeah, high number. And specific for ADHD, we actually recently started a kind of a referral partnership with a digital health application called Beyond ADHD. It's a virtual clinic, and it specializes in the assessment, diagnosis, and treatment of ADHD in children and adults. And so it's a group that is mostly made of nurse practitioners, and they use Pillcheck now to assist with prescribing, making prescribing decisions. We just did a monthly report for them. So out of the body of out of the referrals we received in the last month, 60% had to adjust something, either drug or dose. So it's very, very common. And what I like, especially in the guys at Beyond ADHD, like very much, because they're all medical professionals, that prescribing is very sophisticated task. And with the Pillcheck results, nurse practitioners or physicians or primary care doctors can have just greater confidence in selecting a medicine that's right for that person. And the fact that they can look at the letter written by a deep expert like Dora here, and even pick up a phone and have a brief conversation, that just helps to bring everyone on the same page. And just another thing about Carolyne, you said, let's pick one condition, which is very nice for a conversation. But in reality, I hear from our plan sponsor partners, there's a huge number of ADHD claims for young women, for drug claims related to ADHD. So being a woman is not a condition, but it's a fact. And when prescribing decisions are made for females, their hormonal status have to be taken in consideration, and other factors that are unchangeable, but they need to be all brought together. And that's something that is very central to the design of Pillcheck service. So you don't have to worry about choosing a test that covers only one condition or one concern. We have broad coverage in every test, and that whole person approach is really proven most effective. It just gets you faster to the result being your treatments are personalized to your needs.
You know what? Way to keep it real, Veronika. That's exactly, when I think about it, that was fairyland, right? Because there's a lot of times people are on more than one medication. And now this problem just got bigger, right? If you did not have a pharmacogenetics test in hand and you're on, let's say, 4 or 5 medications or having a few different conditions other than, gender, et cetera, then the trial and error program becomes even greater, because you don't know which medication is interacting with each other or with your body. And that just extends, cost and health and well-being and frustrations, absenteeism from work, whether it's yourself or your child. So thank you for calling me out on that, because that's it's significant. It's significant. So
I can't believe it's 4 out of 5 that people are changing. So that's the importance of it. And maybe you're right, Carolyne. When you think about that, it's true that sometimes, like, you see those like stats where someone's on 2 prescriptions and they're ended up on 3 and they're at 4, and then where's this cycle? And trying to improve someone's well-being is obviously what everybody's end goal is. So maybe Gavin, as an advisor, you and I can relate to this. That obviously, due to Privacy Act, we can't give up information like Carolyne's on this drug and Rob's on that drug. But how have you been able to use, whether it's a lot of data that we can get from and utilization reports we can get from carriers that are broad? How have you been able to implement products like Pillcheck into your practice, and talk to us some of the effects that you've seen? Because I know you've been a real champion in this area.
Thank you. Yeah, it's been a bit of an evolution. Early days, I was very reactive in using the report. We would cover them kind of on an ad hoc basis through health spending accounts, maybe. At the time, very few insurance companies would allow us to actually add them to a plan design, so that wasn't even an option back then. So health spending accounts were the best we could really do. But it's fairly reactive. You get calls from a client sometimes where they're asking you about coverage for a certain number of DINs, or they're saying, is this covered? Is that covered? How about this one? And we're not sure what I'm going to be prescribed yet. And so those are very clear examples of, they're actually looking to wait to see if something's funded, to see as to what prescription they're going to go with. So we get a bit of that, right? Especially with formularies these days, you never really know, are all drugs going to be covered? The answer is usually no. So they're trying to whittle down, to a couple different drugs, but you might find the one that's covered might not be a good fit for you metabolically. And so that's a missing part of this conversation, right? Of balancing kind of the funding, what's the best drug versus which one's going to be paid for, right?
And especially step therapy drugs. There's more and more drugs that are on step therapies. We all know, heard of a drug, Ozempic. So as one, but you're absolutely right. So sorry to cut you off there, but it's not just in ADHD. There's so many medications that could impact members and their decision to take it or not because of a cost factor.
Right. Well, that's it. And so early days, and then we would see someone come back and say, all right, well, let's try this one now. You said that one's covered, right? But just anecdotally, I'd say the more kind of emotional ones are where I'd have an executive I'm working with, and they talk about the struggles of their teenager, right? And how they're cycling from one mental health medication to the other, and how it's affecting behavior in school and sports. And I've had a few where they just feel like they're at their wit's end. And they don't know where to go. They don't know what to do. And, you've got a psychologist and a doctor sometimes butting heads, and a psychiatrist in the mix. And so some of these situations can be highly emotional, highly complex, and they just need help. And so I find those were some of my early examples of where I'd kind of react, right? I'd say, well, have you done one of these? And just whenever you show people them, and they'll say, well, how much are these? They thought they'd be more expensive. And oh my God, I wish we had done this 3 years ago. And you get a bit of that from these people, especially when they've just been in these situations for so long and they wouldn't talk to you about it. And so I've really kind of changed how I talk with these. I try and get a little bit more in front of them to let people know that these do exist, so that they're not 2 to 3 years into an extremely private situation before they knew about them. I've done my best to try and work them into actual plan design when I can, so that it can be seen in a booklet, that it can be seen in a portal. Those are great steps for our industry, even to go as far as building it into even my own plan designs as we sort of custom create some product. And we think about, all right, if we're going to have a user going through a journey, what do I want the journey of my own clients to look like. We go from diagnostic, we go to treatment, and we go to recovery. And recovery in our world often includes a prescription, right? And how fast and effective do we want that recovery to be? And there's really nothing else like a pharmacogenetic test. So, to me, it really is a baseline coverage. And when we think about, a cost of an expense in the hundreds of dollars, I'd rather one of these be covered. We don't think twice about covering $500 a massage, right? So, and why is this some big conversation? And especially where it's a one and done, right? And so to me, it's like the no-brainer of no-brainers. It's just a matter of creating awareness, getting the risk model sorted out. This should be an actuary's dream from a risk perspective. A one-time charge, highly low risk. It's not one of these big recurring claims as to what that's the stuff they're really worried about. So to me, I think it's more of an awareness and a demand issue. So I think insurance companies will spend the money on systems when there's demand. And that's really up to us giving advice. And to me, like now, I feel like it's really elevated my conversations with customers, and we're better able to help them with a tool like this.
Well said. And that's you're getting the right prescription, for the right condition at the right time. And the importance, as you said, of like covering something that's a few $100s as a one-shot deal versus potentially paying out, it could be hundreds of dollars. So some of these drugs are very inexpensive, but then all the other ripple effects about absenteeism, all of a sudden, if I just can't focus at work, so then you talk about presenteeism, or if because of it, you mentioned mental health medication, and I know Veronika, that's an opportunity as well for that's available through Pillcheck, is that someone could ensure they're on the right medication for based on their DNA. And they talk of somebody maybe being off work for several months, that maybe it has to do with the prescription versus not. So maybe that's also a question, Veronika. Do you find what is it, is it people that are on prescriptions that will typically go for this pharmacogenetic testing? Or do you recommend this test just to everybody in general to be aware before, to know how their body will react to certain medication?
Well, every person has their own sort of balance of risk rewards and how much you want to invest in health and so on. We work with quite a few disability claims groups. So when we receive referrals from them, it's always people on prescriptions or somebody who's so fed up with their prescriptions they're no longer on one, but they need to be. So it's a restarting kind of situation. Very much what Gavin conveyed to us, kind of people at the wit's end, navigating through the maze of decisions that they don't really have the right information to make decisions, and the care providers also don't have the right information. So as you were saying, Rob, simply removing financial barriers to recovery, to better health. The Pillcheck service is $500 in the workplace. So it's a worthwhile investment. And by offering coverage as a sponsored benefit, either with eligibility verification or kind of preferred pricing or HSA. Basically, you're putting on the table option that will bring great clarity to someone who need medical treatments. And specifically, Rob, about what's the impact. So Pillcheck service was used in a study, actually sponsored by Green Shield, to measure and answer that exact question. And the answer is 10 weeks. So if we're dealing with people who are struggling with mild to moderate depression and anxiety, using Pillcheck Insights accelerates recovery by about 10 weeks. And so you can multiply it by salaries and see the ROI for sponsors is very, very significant.
And even for those that say don't have it covered under the benefits plan, I understand that it is recognized as a medical expense for tax purposes. So people could choose to do this anytime, and whether you're taking medications or not, as mentioned, it's a DNA testing. It's going to be good for your life. One question I would have is, it comes down to education and awareness. So I'm going to drill back down to Gavin and Rob. as benefit plan experts, you and your teams clearly do a lot of education within a plan, and so solely should with benefits experts, with the plan sponsors. What other tips? What if there's a plan sponsor out there listening today? What other things can they do to help support education and awareness of what is a pharmacogenetics test, and how to just help people normalize it, right? Know that it's not, some secret conspiracy to get everyone tested. Like, it's for the benefit. How do you balance that?
Gavin?
Well, I'd say doing webinars is a good start, but I'd usually start with even broker friends of mine. It's powerful when you do it yourself. When you do one of your own, you can speak to it, you live through the process. It's like saying, hey, we think people should get these tests done. It's for the greater good. And people say, well, what came out of your test? Oh, I wouldn't get one of these. It doesn't really fit. Like the people in the decision-making tier of any company, if they are serious about improving the health outcomes of their employees, and ultimately, I mean, people come to us and say, well, we want to save money in our benefits. How do we reduce our price? And the broker of today generally doesn't say, well, how many people in your company have done a pharmacogenetic test? Like, that's usually not the answer to that question about saving money. It's, well, we can shop. Let's put a different logo on your drug card, and that's going to fix everything for like a year. This is more sustainable, right? And I think if you get the right HR department, I mean, they've got their stories, right? They've got their stories of people on mental health medication, and I've got mine. The side effects for mental health medication specifically are some of the more, I'll say, wilder side effects that I've heard. I've had somebody talk about the dreams they've had. They couldn't handle the dreams. And, they just could not go any further on this drug because they're having these horrific nightmares. And so I'd say this stuff is advisor 2.0 stuff. Like, this is, how a modern advisor is going to talk about sustainability, about saving money, about plan structure. This isn't, let's shop the market and see what we can do, and let's put the plan on a credit card, but we're going to cover things the same way we ever have, but somehow get to a different result in future. It just doesn't happen, right? So this is how we can be better as an industry, and there's so much more power in knowing something than not knowing, especially when the dollars are high. The price of medications, as Rob alluded, this is a huge part of the cost of our premium. So it really requires the focus in these kind of nitty-gritty details that we're giving it today.
Yeah, and I didn't mean to quickly laugh when you made that comment, but you're absolutely right, Gavin, because I think we've heard too many stories where someone's answer is, well, let's go to market and find something cheaper. It doesn't work like car insurance. It's, right, you manage your min costs, you manage your claim costs, or you make people healthier. And I think more and more in society, people are looking, for healthier options, healthier choices. We're in a state where, everything's on the rise. We've been talking about ADHD drugs and the number of people being diagnosed, obviously with greater access to tests, is super. We see more ADHD medication in benefit plans than ever before. And a lot of them could be related just for, like some of the groups are like young adults in their 20s that we're seeing that more and more. And you're absolutely right, Gavin, is that, it's all those other aspects of a benefit plan, like, for an organization, whether it's absenteeism, disability costs, burnout's a problem. So if you have people that are off work and you have a department of 5 and one person's off, well, now those 4 remaining people, they got to pick up the work for that individual, he or she that's off work. So you're adding to stress, that starts to snowball beyond the impact of just looking at, well, like what's in our benefit plan and costs are up, let's find something cheaper or let's cut coverage. The whole modernized approach is to look at strategies that can impact and improve somebody's outcome. And you want to talk about a return on investment. These are strategies that you can actually see a true ROI. I think that's kind of how I'll leave it there.
Yeah.
Yeah, but actually the note about Vyvanse and the ADHD, that wasn't on my original report. That drug didn't show up. And kind of the neat thing about this one is I get emails every once in a while that says, oh, we've updated your, so now Vyvanse is on my report. And I paid for this report 6 years ago. And meanwhile, they're updating the database. So if I'm ever prescribed Vyvanse, I don't have to buy another one. So that's the other side of it, is it can kind of grow along, like the data set grows with the employee population, which I don't know that all reports work that way, or the companies making a decision on this, they really get that, especially as new drugs come to the market.
You just said something too, Gavin, that sparked a thought is like, overall, this would actually help the Canadian healthcare system, which is so pressured for the amount of appointments of people going to see their doctor, returning to see their doctor or their pharmacist, playing with prescriptions. If you have the recipe right up front as to these are the drugs that are effective, how much are you saving the healthcare system and the time of patients reviewing this with their doctors? So really, this is saving money, is saving our healthcare system. It's a recipe to help people feel better faster and keeps, even the families and the loved ones around people active at work and living calmer, less stressful lives. Because when you're trying to help your loved one navigate ADHD or mental health or any condition, really, you're getting to the answer faster. So this has really been an incredible episode. I feel like we've just scratched the surface, but the silver bullet is there, folks, right? People always ask, what's the silver bullet to help benefits? And truly, this is helping check a lot of boxes here. So maybe we go on to some final comments. We'll start with Dora. What's going through your mind? Is there anything else that you want to make sure our listeners hear before we end this episode?
Yeah. So what Gavin really emphasized about getting it early on before you even start any medications really resonated with me. So thinking back to pharmacy school, which was like 20 years ago, or maybe a little bit more, one of the key pharmacogenetic things that came up at that time, I think it was at a hospital at Sick Kids in Toronto. There was a young mom, and she had just given birth, and she was given codeine, which is sort of like standard practice after pregnancy or giving birth, given codeine for pain relief. So turns out she was a ultra metabolizer. So she metabolized codeine really fast, and when that happens, it turns into morphine, which is the active ingredient. But the consequence of that is that she had too much morphine in her system, and she was breastfeeding, and unfortunately the baby got the morphine, and the baby passed away. So that was like very shocking, and it was sort of my first introduction to pharmacogenetics. But keeping in mind she's a young mom, I bet she was never on any medications, had no idea her pharmacogenetics, and had she had this opportunity, even before ever needing medications, this never would have happened. So it really emphasizes how important it is just to have a baseline of your DNA, just so you know, even before you need medications, what to do and what the safest choice is for you.
Wow. Absolutely. Wow. I don't know how to follow up with that. That's amazing, but I can see why you're a champion of pharmacogenetics. So thank you. Veronika?
Well, as a scientist, I want to be careful about the silver bullet. And what I'd like to emphasize is, yes, all these aspects, Carolyne, you mentioned in terms of feeling better sooner because you're on the right meds and avoiding the, time off and not spending money on medications that don't work. These are all true. But one of the things Gavin mentioned that, like back to ADHD, we now cover medications that we didn't cover before. That's something, so as a company, we made this choice that we want to invest on a regular basis in updating people's reports. And that's why you can get a test today and you will be receiving a report on about 285 drugs, unique molecules, so it's about 7,000 genes. And in 6 months, we'll be adding 60 more drugs. And how do we do that? We follow guidelines. So we have a whole team of people following literature, drug labels. And this is we consider, it's an expensive thing to do. We consider it's a safety feature. Safety in a sense, when somebody uses a Pillcheck report, whether it's your physician or yourself, you're looking at it, we want to make sure that you have up-to-date information. And specifically in ADHD, for example, guidelines changed. And because science evolves, no new data comes out, and something was classified normal 2 years ago, now it's classified ultra-rapid metabolizer, you need to adjust dose. So this is seems like, what's a big deal because I want to solve my problem now. But the point of Pillcheck, as we engineered it, is to serve you on an ongoing basis and always follow the evidence. We want anyone using our results whether it's healthcare provider or individual, to have complete confidence that they're dealing with facts that are correct and relevant to them.
Thank you, Veronika. I think I definitely feel the passion and the commitment to, ongoing lifetime development, not just a one and done. And I think that obviously sets you apart in the marketplace, your company helping long term. Gavin, any final comments? Gavin and Rob, from the advisor perspective.
Sure. Well, I'd say that part of our role as an advisor, I'm happy to share my experience with peers in the industry. I got to the pharmacogenetics world pretty early, and I know that it's still a new muscle to flex for others. So I'm happy to share my experience and to mark this as a safe space for us to play in. And to advise in and to encourage others to really learn about what this is, because it is a good tool to pull out of your toolbox on a regular basis. This is not something that, well, if I find the right client, it's like all clients should kind of know about these. I think it's just part of our repertoire. And the other side of it is, I think it is part of a bigger conversation around, how do we rationalize the market? We've been talking about removing waste from the pharmaceutical system for years and years and years and years, and there's a lot of different levers to pull, so we've got preferred provider networks back in the news and potentially looking to be legislated and regulated, and this isn't that. This is a great way to remove pharmacy waste from a drug plan in a very, very non-controversial way. So as far as what tools do we have to reduce pharmacy waste, this is a really safe, clear, transparent, really smart way to do it. And I don't think any of our clients will end up in the news if they decide to cover a pharmacogenetic test versus pick one pharmacy as their main preferred pharmacy as the other way to reduce waste. So again, like when we think about our toolbox, this is a really nice tool for us to have.
Well said. Thank you also, Gavin, for your insights, being an early adopter and having that client experience and sharing with our listeners how you talk about that with clients and plan members. Rob, final word?
I hope people found this really informative today about just as we talk about modernizing options and solutions. And I think there's two things. One, it's not if someone's going to need the healthcare system one day, it's when they're going to need it. And kind of the importance of what the other thing too is that everybody's looking to be proactive with their health more than probably ever before. And what a great way to figure out if it's the right prescriptions for your actual body. And I think that's kind of critical. And most people aren't aware of these options. So even I think as an employer, just making these options aware, even on a voluntary basis, to say, hey, we have access to this unique pharmacogenetic test that people will explore. And I think more people than not that we find when we talk about it, more people are interested than not. So I thought it was really informative, Carolyne, and thank you everybody for joining us today and providing your expertise and experience. Really appreciate it.
Amazing. And I'm going to go rip open my package in the mail and swab my cheek and get to the post office. So get my report now that I know what to expect. So thanks, everybody. Thank you for joining, everyone. And we'll see you on the next Benefits Alliance Voice. This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.